Hello, this is your teacher, and welcome to this module on sustainable logistics in healthcare organizations. Today, we will expand a bit on the topic, why the demand for a green transition in the healthcare sector. Healthcare plays a crucial role in improving lives and saving patients, but the sector also significantly impacts the environment. From energy-intensive facilities to the vast consumption of medical supplies, healthcare generates considerable waste and carbon emissions. In this module, we will examine a few of the key reasons behind the growing need for change. You will learn about some of the environmental challenges in the sector, the benefits of adopting greener practices, especially regarding plastics, and a bit about how logistics can play a pivotal role in driving sustainability. Remember the introduction video? This video tried to give you a brief introduction to the three concepts of sustainability, logistics, and sustainable logistics. But why should you, as a healthcare worker like Julie and Peter, care about sustainability? Yes, there are many processes and a lot of logistics, handling textiles, medicines, consumables, beds, waste. But is it really that big of a deal? Remember, healthcare is a massive sector. According to Healthcare Without Harm, it represents over 10% of the EU's GDP and is responsible for around 5% of the region's net climate emissions, significantly impacting human health and the environment. There are thousands of workers, patients, suppliers, etc. in the sector, and thinking sustainably in the healthcare sector is essential to achieving Sustainable Development Goal number 12, responsible consumption and production. The emissions generated from the healthcare sector not only impact the planet, but also pose risks to human health. By adopting more sustainable practices, the sector can reduce its environmental footprint while continuing to provide high-quality care. Remember Julie and her observation about plastics? The global medical plastics market is currently worth 22 billion, or 2% of total plastics production by value, and is growing by 6% per year. The US consumes around 40% of medical devices manufactured globally, followed by Europe and Japan. This means that the healthcare sector in Europe is a major consumer of plastic, contributing significantly to plastic waste. As a healthcare worker, it's important to take this issue seriously and actively work towards reducing plastic use and promoting sustainable alternatives in daily practices. The scale and growth of plastics in healthcare is alarming. The growth of single-use devices is largely driven by concerns of potential infection from contaminated medical equipment, by convenience, and by the growth of healthcare in emerging economies. But while the convenience of plastic and single-use items has driven their widespread adoption, this approach is neither sustainable nor sufficient when addressing the urgent need for more environmentally responsible healthcare practices. And just to be clear about the link between plastics and logistics, the consumption of plastic in healthcare is deeply tied to logistics, as the production and distribution of plastic involves a massive supply chain with numerous stakeholders. The plastic must be produced somewhere, it must be sourced and bought, it must then be shipped and stocked at the hospital or nursing home, and then used, and then thrown away. This is an example of just one of the many supply chains that are in play, and this is logistics. By reconsidering how plastic is used in daily operations, healthcare assistants can drive change directly where it happens. Small adjustments in how consumables are handled or reduced can ripple across the supply chain, influencing suppliers, manufacturers, and ultimately contributing to a more sustainable system. Take one surgery as an example. The consumption of plastics and waste is enormous. 4.5 kg after one surgery is not uncommon and were a result from a study at a Norwegian hospital. Can you imagine 100 football fields covered with 1 meter high layer of plastics? That is approximately how much plastic from Norwegian hospitals is estimated to be incinerated each year. Plastic use in healthcare is a big issue. Syringes, gloves, wipes, bed sheets, and gloves being the largest single item by volume. Healthcare workers should critically consider the extensive use of plastic, as these examples contribute significantly to plastic waste. By rethinking daily practices, you have the power to reduce waste and drive meaningful change for a more sustainable healthcare system. Non-medical single-use items are also a large source of plastics used in healthcare, despite reusable alternatives being readily available. This reliance on non-medical single-use plastic items in healthcare is often driven by concerns about convenience, time efficiency, and the perceived safety of disposables. However, many reusable alternatives are readily available and can be just as effective, if not more sustainable, when properly managed. Shifting towards these options requires a change in mindset and operational practices to prioritize long-term sustainability over short-term convenience. Why is that? Is it like this where you work? A study in the Netherlands showed that approximately 50% of total plastic waste by weight was disposable packaging, composed of at least 15 different types of plastic. Packaging can be effective, but not when a large percentage of it automatically goes in the trash. Standards must be improved, procedures and routines rewritten. This demands collaboration between different levels in the sector. There might be a perception that disposable items is logistically more straightforward, since they are quicker to buy, use, and throw away. They are also seen as cheaper. However, when looking at the whole life cost, reusables are in many cases cheaper over the long term compared with single-use items. Studies have shown that reusable medical devices can be more cost-effective over their entire lifespan compared to single-use items. For instance, reprocessing single-use devices has led to significant savings. From a study in 2019, hospitals saved over 21 million through reduced waste disposal cost by reprocessing single-use medical devices. Additionally, a study on reprocessed single-use devices in laparoscopy found that hospitals could achieve substantial cost reductions by adopting reusable alternatives. These findings suggest that despite higher initial investments, reusable devices often result in lower overall costs due to the savings in procurement and waste management. Let's say Julie and Peter wants to do something about all this plastic at their respective areas they work. What can be done? 1. They can conduct a plastic waste audit. 2. They can analyze procurement data. 3. They can analyze this data, identify priorities, and create an action plan. When conducting a plastic waste audit, start by identifying plastic use points. Observe daily operations to pinpoint where and how plastic items like gloves, syringes, or packaging are used. Categorize waste. Separate waste into categories such as medical-grade plastic, packaging, and non-medical single-use items. Track the quantities. Record the volume and type of plastic waste generated over a specific period, like a week or a month. Engage the colleagues. Involve other staff members to get a comprehensive understanding of how plastic is used across departments. And finally, document findings. Use checklists or digital tools to organize data for better analysis. 2. Analyze the procurement data. Collaborate with procurement teams. Partner with the purchasing department to access records of plastic items ordered, including quantities, costs, and supplier details. Use the inventory management system to check digital inventory systems for data on plastic supplies stocked and used regularly. Monitor delivery records. Review invoices or packaging slips to identify the volume and types of plastic materials delivered. Analyze the waste. Compare procurement data with plastic waste audit findings to spot inefficiencies or over-purchasing. And finally, request sustainability metrics. Ask the suppliers for information on the recyclability or environmental impact of their products to inform more sustainable purchasing decisions. Once the data is collected, analyze it to identify the main sources of plastic waste and the most frequently used single-use items. Prioritize areas with the highest potential for improvement, such as replacing high-volume single-use items with reusable alternatives. Create an action plan with clear steps like reducing overstock, implementing reusable solutions, and collaborating with suppliers for sustainable options to address these priorities effectively. Raising awareness among healthcare staff is key to driving sustainable change. Prevention is better than cure. By reducing unnecessary plastic use and promoting reusable alternatives, we can tackle waste at its source. Educating teams about the environmental and cost impacts of plastic waste empowers everyone to contribute to more sustainable practices in their daily work. And so, why the demand for a green transition in the healthcare sector? There are probably many reasons, but plastic use is one of them. From the extensive use of plastic clothes, gloves, packaging, and bed sheets, and probably many more. By using single-use plastics, you contribute to a supply chain that contributes to increased plastic pollution, threatens wildlife in oceans and on land, and exacerbates climate change through high energy consumption in production and waste management. Now, this has been a short video about some of the reasons why the demand for a green transition in the healthcare sector, with emphasis on the use of plastics, is important. Make sure to check out the other videos in the series about sustainable logistics in healthcare organizations. Thank you for watching.